Hey guys, it's Heather. I just wanted to do a quick video on a couple of, actually 3 books that I got this semester that really helped me out. One thing I've noticed from watching other people's nursing school videos is it seems like besides just your regular textbooks, there's so many other, I guess, supplemental books that really help you out throughout the semester. And just in my first semester, like I said, I got 3, so I'm sure that I will be acquiring many more throughout my next semesters, but I just wanted to give y'all a little heads up of the ones that I felt were really helpful. The first one that I'm going to talk about is something that helped me with pharmacology. And when I took it as a prereq, I did really good on dosage calculations, but the actual pharmacology part I felt was really tricky. I studied so hard for that class, and I made a B, which is good, but for how much I studied, I felt like I should have gotten a higher grade. But I really wish that I had what I'm about to show you during pharmacology, just because looking through a drug book and just kind of trying to memorize it as words on a page like that can be really difficult if you're more of a visual learner like I am. So what I got is called the Mosby's Pharmacology Memory Note Cards, and there's books, like actual books of these, where there's a lot more, but I got this little one to take with me to clinicals and just to help me study for my tests, because in one of my classes we had 5 medication questions on every test. And then, like I told y'all in the previous video, we do have a pharmacology exam at the very beginning of every semester from now on. But these are great. Let me open up to something. Okay, here's one for digoxin, which is a really common med that is used. And see how it has like the little wizard guy right here. It's just got funny little pictures, and it has you know, really important information on it. Watch for certain side effects. And for this, it tells you, that you need to take a baseline apical pulse for a full 60 seconds before administering. Let's see, I don't know if this will focus right, but you can kind of see like a little bit better. So it just kind of has a little picture, and the very top says Wizard of Digitalis, which is another name for digoxin. And then when you flip it over to the other side, it just gives you all kinds of good information. It tells you the classification, action, uses, contraindications and precautions, side effects, and nursing implications. And then it has like certain little parts are highlighted on here. Oops, there we go. And it has like a little key. The yellow is important nursing implications, and then the green is patient teaching, and then the purple right up here are the most common side effects. So yeah, it's just really, really helpful. I found this to be really helpful, especially for, we had to learn about beta blockers again, and ACE inhibitors, and all of those are so similar. It's really hard to kind of keep it straight of what, certain ones had a side effect of, or, just certain things like that. Let me try to find them in here. Yeah. This one, it's a little bit easier, at least for me. It kind of groups them all together. It tells you the beta blockers, they end in the OL, and then it tells you what the basic, their action is, and then the most common side effects, and it gives you 3 little examples of certain beta blockers. So it's kind of just a general overall definition, I guess you could say, of the different drugs in the beta blocker class. Obviously, if you need to know something really specific about a specific beta blocker, you should look that up in your drug book. But if you just kind of need to know general specifics about beta blockers in general, it's really helpful. Also on here, though, since there are a lot of different little things that go on with beta blockers, it does tell you certain things about like that, let's see what it says here. But the propranolol, Inderal, has both beta 1 and beta 2 blocking action, and just certain things like that. So yeah, I felt like this was a really helpful book. I got this on Amazon. It was like $15 maybe. I don't know. One of my friends actually had this first, and she showed it to me. And one of the main reasons I bought this was because it said something about Coumadin. You need to decrease your intake of green leafy vegetables, and I ended up missing that on a test question. So I thought, if I could have gotten a whole entire test question just from one little thing on this book, so I ended up buying it. She got it at, I think, Borders, and it ended up being quite a bit more expensive. I think she paid almost $30 for it, and I got it for nearly half off on Amazon. So yeah, this is a really great buy. And like I said, there's actual like big books of it. I think there's 2 or 3 of those. So if you find that this doesn't have as many drugs as you think, as you'd like. I mean, it's got a really good amount. I only use probably like 4 or 5 drugs out of this. Well, I guess I take that back. Probably about, I don't know, 7 or 8 out of this, but mainly it was the beta blockers, ACE inhibitors, and then there's a little bit about insulin in here, and the blood thinners, which we talked a lot about this first semester. So yeah, I thought this was a great buy. I highly recommend it. Probably in subsequent semesters, if I find that some of the drugs I'm needing aren't in this book, I'll probably purchase another of those books. But the next book that I'm going to talk about is something that we only had to do a couple of care plans this semester, but they are really hard and time consuming, and I actually ended up failing my first one. I used this book when I did it, but my teacher I failed it by 1 point, and my teacher was just a really hard grader. They weren't even really for actual grades. Like, we got graded on a pass-fail basis this semester, but I was still really disappointed that I failed my first one. You know, failed, even though it wasn't for an actual grade, but my next ones I, you know, improved on a lot. But I got this book, which is the Nursing Diagnosis Handbook. This is not the newest edition. This is the previous edition, which I highly recommend. For something like this, honestly, not that much is going to change in between the editions, except for, you know, I don't even really know what they changed. Maybe some errors, like with spelling or grammar or something, I'm not sure. But the brand new version of this book was $50-something on Amazon. I found this one on half.com for like $6, and it was only 2 years older. And like I said, I highly doubt there could be really that much of a difference. So if you're interested in getting a nursing diagnosis handbook, I highly recommend you see how old the previous edition was before going ahead and buying the new one, because if it's only, you know, a couple years, it's probably not going to make that much difference, and I just saved $45 by doing that. But this is amazing. This is like the website that I posted on one of my previous videos, but this is the actual book, so it's a lot more in depth, and it has you know, a lot more nursing diagnoses. So I'm just going to open up to something that I used a lot, and this is the nursing things about pain. I don't know how well you can see on it, but it just gives you like a whole lot of information. It gives you here the pain level outcomes that they'll tell you, like a pain level should be, you know, on a scale of 0 to 10, and just certain things like that. It just gives you certain, you know, different rationales for each intervention that you do. There's multicultural, you know, interventions and home care interventions, so it's just great. It gives you a definition, defining characteristics. Yeah, it's just a really, really great book. So I highly recommend this one. It says actually here on the back it's the 2007 to 2008 NANDA approved. So I mean, I guess there could be a little bit more, but honestly, at least from what I've experienced here, I don't find that I need the, you know, 09, 010 version. As of now, it has everything that I need in here, and after I, you know, improved from my first one, which that was my first one, so there's room for error, but I found my grades improved a lot after I started using this book. So I highly, highly recommend it. And then the next one I honestly didn't use a ton this semester, just because it was my first semester and we did, you know, foundations of nursing and the really basic nursing skills, basic pharmacology type things, and we haven't really gotten into pathophysiology of, you know, specific diseases. We did, you know, like acid-base balance and nutrition and, you know, just kind of stuff like that, care of the elderly adult and everything. But I went ahead and bought the NCLEX book, and this is for the LVN or LPN version, since that's the first part of my bridge program is the LVN portion. But it's really, really great. It has tons and tons of NCLEX questions in here. It just basically outlines certain things that just like that you would read in your book, but in outline form. I think I have a page that's marked here. It's called Care of the Older Client, because like I just said, we did the elder things, and it shows you, you know, it has pictures of a person who has osteoporosis. Sorry, I got cut off. It has mental health concerns. It tells you about how, you know, suicide of elderly Caucasian males is increased, which that was one of my test questions, which was helpful. It's a really helpful book. I've heard really great things about it. It does come with a companion CD, which I have not used yet, just because I feel, for what I've done so far, at least the questions that are in the book are helpful. But this was actually recommended to me by, well, not me personally, but my class, by our nursing tutors, that they said that this is just a really great book, and that I've heard that after you get into the harder semesters, like next semester, that it is really, really helpful. So yeah, those are the 3 books that I felt were really helpful this semester. I am hoping to find more things that will help me. I've heard that the Nursing Made Incredibly Easy series is you know, really amazing, and so I'm looking into stuff like that. I don't really know exactly what our classes are for next semester yet. They released the schedule, but I don't have like an actual definition of the classes yet, but I will get those up soon to tell you all about my classes. I think I have advanced nursing skills, I have intermediate clinical, and I have nursing and health and illness too. And so then, yeah, foundations of nursing just kind of over, and then we moved on from basic nursing skills to advanced, and then obviously beginner clinicals to intermediate clinicals. And then the subsequent semesters, except for 4th semester, I only have 1 class 3rd semester, and that's nursing and health and illness 3, and then we have advanced clinical, and we do have a little bit of a lab. We learn IVs, but I don't think it's an actual, like, it's enough to be a class. It's like an extra add-on type thing. And then my last semester we have nursing and health and illness 4, but we also have OB and peds. So that'll be interesting. I'm getting way ahead of myself here, but anyways, so yeah, those are the books that I felt really helpful this semester. So if y'all guys have any questions, if you want me to go into more detail about the books, I don't really know what to say about them. Honestly, I used this one the most, and then I used this one. This was only for clinicals, so I didn't use it as much. I know that next semester we do care plans a lot more, so I'll use it a lot. And this one, I didn't, like I said, I didn't use a ton, but I can tell it's going to be very, very valuable to me in the coming semesters. And I did use it this semester a little bit, so. Anyways, guys, if y'all have any questions for me, let me know, and I will do a new video about my classes as soon as I can get a kind of description of them, or see kind of more what our semester is going to look like. But anyways, guys, I hope y'all have a good holiday. If I don't update before then, I have a feeling I will, but just in case I don't, have a really, really good holiday. It's really warm here. It doesn't feel like it's about to be the holiday, so I'm trying to get in the holiday spirit. But anyways, guys, y'all have a good day. Bye.